Now we're going to look at the megaloblastic anemia. So, at the megaloblastic anemia. So, the first thing we need to know is that there can be due to the vitamin B12. There can be due to the vitamin B12 deficiency. So, under the vitamin B12 deficiency, there can be due to the decreased intake. So, this can be due to the decreased intake. So, under decreased intake, what are the points? Under decreased intake, it can be due to the inadequate. So, inadequate diet, or it can be due to being a vegetarian diet. Next is it can be due to the absorption impairment. So, the impaired in the absorption. So what happens in case of impaired absorption? This can be due to the intrinsic factor deficiency. So IF deficiency, then it can also be due to the PA, that is a pernicious anemia. Then it can be due as a result of the gastrectomy. So it can be a defect of the gastrectomy, and then the malabsorption states, MA malabsorption states, it can be a result of this. Then there is also the diffuse intestinal diseases, the DID, and this can be the lymphoma as well as the systemic sclerosis. Then there can also be due to the ileal resection. There can be the ileal resection and the ileitis. Next we move on to some of the competitive parasitic uptake. It can be due to competitive parasitic intake. So what comes under the competitive parasitic intake? So this can include, there is the fish tapeworm infestation, and it can also be due to the bacterial overgrowth. It can be due to the bacterial overgrowth, and this is in case of the blind loops. It can go in case of the blind loops and the diverticula of the bowel. So blind loops and the diverticula of the bowel. So till now we saw a complete heading, that was in case of the megaloblastic anemia due to the vitamin B12 deficiency. Now we'll jump on to the folic acid deficiency causes. So what are the folic acid deficiency causes? It's a similar thing, that is, we can say it is a decrease in the diet, decrease intake to be specific. So under decreased intake, what are the points under this? So under this we can say it is due to the inadequate diet, and it can be also due to the alcoholism, and it can be due to the infancy. Next we move on to there is a impaired absorption. There is impaired of the absorption. In case of impaired absorption, this can include the malabsorption state. And there can also be due to the intrinsic intestinal diseases. Then it can also include the anticonvulsants as well as the oral contraceptives. This is all under the impaired of the absorption. Next we move on to the increased loss. So there is increased loss, and what does this include? This includes the hemodialysis. Increased loss is nothing but the hemodialysis. Then what about the increase in the requirement? So increased requirement, this includes in case of the pregnancy as well as the infancy. Next, it also includes the disseminated cancer as well as a marked increase. So there is an increase in the hematopoiesis. So this all comes under the increased requirement. That is in pregnancy, infancy, disseminated cancer, and marked increase hematopoiesis. So lastly, we are looking at the impairment of the utilization. So there is impaired utilization. So what happens in case of impaired utilization? So there is the folic acid. There is folic acid antagonist. So there is folic acid antagonist, as well as it can be due to the unresponsive. So there is unresponsive to the vitamin B12 or the folic acid therapy. Unresponsiveness to the vitamin B12 and the folic acid therapy. Next is there is a metabolic inhibitors. So there is metabolic inhibitors. So what happens here? The metabolic inhibitors of the DNA synthesis. Metabolic inhibitors of the DNA synthesis or the folate metabolism. Folate metabolism. So this was about the megaloblastic anemia. So we saw the vitamin B12 deficiency causes, as well as we briefed on the folic acid deficiency causes. So to learn and grow daily like this, please do subscribe.